Okay, this is a hip spica. We've already put stockinette on the patient here. This is going to be a 1.5. This is going to be the whole leg. This will be the half leg. We put stockinette over the torso. We actually have a gown as padding inside the stockinette that we will be able to slide out. The reason why we put that in there is so that the patient has room to breathe. Typically you will use this cast for a number of different reasons, but femur fractures is probably one of the more common ones. I'm going to ask you to hold your arms right up there. Very good. I'll start with the body first. The parameters of this cast is going to be right at nipple line. And then depending on which leg, obviously, that leg could be completely included with the foot, or you can do about 4 finger breadths above the malleoli, very similar as you would a cylinder cast. The hardest part about rolling this cast is going to be interns triangle, which is exactly where I'm going right now. The neutral position for this cast is the knees flexed and the hips abducted and flexed. Again, femur fracture is very common. Pelvic osteotomies, femoral osteotomies. Most of the time you'll do this in children. You can do this in adults as well. The only time I've ever done it in an adult is for a chronic hip dislocator. And that reminds me, DDH is also a common reason to put this on somebody. Something that the Pavlik harness or the camp brace isn't working very well. And on the half leg, you're going to go about 4 finger breadths above the femoral condyles. A couple of areas that you need to really spend some time with. Is going to be the spine and the pubic symphysis, the ASIS as well. I just pad everything. I pad the post in with the patient. Excellent. I'll use a little bit of extra foam padding. I like to use a type of felt, but I'm going to use the foam padding so that you can see exactly what I'm doing here. making sure I spend a little bit of CAD the ASIS to press on both sides. The spine. And I'll cut one more out for the pubic symphysis. Some people will also do this on the patella, right here. Excellent. And I can start rolling. That's okay. Again, normally these patients will not have had anything on, no clothes, just whatever stockinette you give them. And these patients typically get a bar between their legs. On a female, that bar will be on the top, and on a male, that bar will go on the bottom. What I mean by that is being on the top part and or the bottom part. in turns triangle being your weak part of this cast. Some people will actually put a splint in, even a fiberglass cast. I've seen that happen many times. Okay. And then just a matter of letting it dry. Some people believe that you should really cinch down the ASIS on this. This would be one of your molds. So I'll just grab an ace wrap and let the ace wrap mold for me. I'll mold the pubic symphysis. And we're on wait mode till it dries. Give that some time to finish drying. Good, perfect. Squeeze some more clean. If you're doing this by yourself on an adult, some people will not dip the first couple rolls to buy some extra time. I've done that in the past and it does work. Some will argue that it gets hotter. Don't really have a preference on it. If I could do it all in one, I would, and dip the rolls all the way around, but again, I believe that the cast should be setting up before, or sets up as you are finishing the cast. See if I can find the bar. This would be a good time to go ahead and add that bar. Remember, women get it on the top, men are more going to be on the bottom. This will go, there is no set parameter. You just don't want it straight across from one another. You will actually angle it. And this adds strength to the cast. Now on some children's casts, you don't need to do that. Gloves. And grab Again, just like before, anytime you add something to the cast where the cast is already hard, you need to make a little bit of a bed, lay it down on the cast. Then you can go ahead and add your bar. And one more roll should cut it. And this bar is to add strength to the cast. Now I will reach in here and pull this out so that she can breathe a little bit better. And as soon as this is set up, we'll get her off of this and trim her out. You okay? I'm going to move you. And well, we can lift her up and stick her on this table. Careful with the wet floor. Just go straight on up. Perfect. Again, the hips have maintained their flexed and abducted position. You can lift your head. Pull that bar out. That should make her feel a little bit better. World of difference. And then the trimming of the caps off of the of this. Should have put the bar in after. So your parameter here is to go no lower than the navel. Up here you want to maintain your pubic symphysis mold. I could go a little bit higher with my cut. You could fold back your stockinette. I'm going to continue to cut out around the butt talks. I'm going to roll you on one side here. You definitely don't want to get what they call butt fall out, which is where the butt actually falls out of the cast. In the top of the butt crack, for this cutout, on the back side, you can fold back your stockinette. And that is your 1.5 hip spica. And you can go back and pedal the cast as well. Therefore, moms and dads can change the padding. Sorry that you weren't able to see that. But this is your 1.5 hip spica right here, completely done. I'll rotate her around so that you can see where I actually trimmed. And see if I can rotate her this way. No, that's not going to work. See this? There we go. And you can see pubic symphysis mold is still intact. Didn't trim it out. Hips flexed and abducted. Neutral position of the hips.